Today I want to talk to you about just sort of odds and ends ideas I had about my practice, sort of an amalgam of thinking that I've had. One gentleman, a plastic surgeon from Italy, had brought his wife over for me to work on her. He had trained with me for a week. He actually watched me operate on his wife's face. And then he went to Southwestern and watched some other procedures performed over there, and he saw fat grafting from two different perspectives. What he said, I thought it was a nice compliment, and also sort of the way that I run my business here, is that he says there's two types of surgeons. There's artists and there are technicians. And he said what he saw with what I did was a combination of both artistry and technical skills. And so that he said that if you look at a lot of times Italian doctors, they're very artistic, but they're not as technically competent. Not saying every single one, I don't want to make a broad statement like that. And a lot of American doctors are technically competent and they're not very artistic. And the marriage of both elements is really how I run my practice here. Another story is a lady that had come into me and had seen a plastic surgeon here in Dallas and had facial fillers. She had put 1 cc of product into each syringe. The cheeks were too big, and she said, why was that? And she said when she goes to him for fillers, he would say, what do you want? You know, and she would say, I don't know what I want. I mean, you should know what I want. You know, you should help me, direct me to figure out how to put the product in my face. And she's always puzzled by this. And I said, don't worry, our relationship will be very different here, because I will help direct, you know, where I should put the product for you. In fact, a large degree of passion I have for my business is helping people decide where to put the product. Many years ago, I was lecturing, and a doctor in another part of Texas was also lecturing. He lectured right before me. He said, always give your client, your patient, what they want, not what they need. Because if you give them what they don't want and then they're unhappy, then it's your fault. And I went right after him. He's about maybe 30 years older than I am. And I went right after him. I said, well, I run my business exactly the opposite than you. Because if I sit here every day and I fill a fold and I fill a fold and I fill a lip, because that's usually what all women want to begin with, because they don't know any other areas that are more complicated or complex to fill, like tear troughs and brows and other areas, then I have a boring life, you know, and I think my patients don't look any better. And so, I think a huge thing is just, I always say, like, if you go to a person that sells shoes and you say, well, I want this pair of shoes that are going to be really, really great for me, and the person says, they're not going to fit you. They're going to have pain in 3 or 4 days if you wear them. Sure enough, you go home, 4 days later, you're having discomfort, your feet are killing you. You go, why didn't I listen to that guy? Well, the guy, all he does every day is live, breathe, eat, and sleep shoes. He knows shoes, he knows feet, he knows arches, and so you should listen to his advice. And so a huge component of the relationship that is established here is I want to guide you to what would benefit you. And a large degree of passion of what I do is every day as I drive my business a little bit different, a little bit better. Christine here, who's filming this for me, has been here with me. How long have you been here?
7 months.
About 7 months. So Christine has been here 7 months, and I don't think a month has gone by without her seeing my develop a new technique, slightly modified, slightly better. And so, you know, a colleague of mine said, you know, Sam, I'm a technician, you're an artist. And what he meant by that is he wants to do the same procedure over and over and over and over again. For me, that would bore me to death, okay? I absolutely love the fact that I can create something new, I can make it a little bit better than last time. A lot of patients who haven't been here for a year, they come back and go, my God, what happened? You have a whole different way of doing things. It's so much better than a year ago. And there isn't a year or a month that goes by without my making a slight modification in my practice to make it slightly better, slightly improved, it's all an idea of seeing differently. And I can tell you my assistants, my MAs that work with me probably see the face better than a lot of my colleagues do, because they've been trained to see the face the way I have. And that's a daily exercise of seeing. And when your brain starts to see and you combine that left and right brain together, you start creating really, really wonderful results. So this is sort of a mixture of ideas about my philosophy, about my life, really, and also about how I run my business and how I help deliver, I think, optimal results for patients that may be different from an experience that you would get elsewhere.